What's going on, guys? So today we'll be going over how to finance Medicare for All. The U.S. healthcare spending is set to be over $3.8 trillion in 2019 alone, which is over $11,000 per capita on healthcare spending, and that's just crazy. I mean, the average per capita spending of the rest of the industrialized world is just over $5,000. So think of that, we're spending around twice as much per capita as the people of any other industrialized country do. Just crazy. So let's go to the next slide. So really this video will be about how to finance Medicare for All. So first, it's probably good to know what the cost is. So what does Medicare for All cost? Medicare for All will require $34 trillion in new federal taxes over the next 10 years, and that's according to the Urban Institute. That's a lot of money, but let's keep going. In total, the current healthcare system will cost $52 trillion from 2020 to 2029, and that's over a 10-year period. So right now, until 2029, the United States will already be spending $52 trillion on healthcare spending, which is crazy. So how do they come to this estimate that we will need $34 trillion for Medicare for All? So the $34 trillion number is representative of new tax receipts. And currently, if you look at this little chart right here that I've comprised, over the next 10 years, we will probably already spend $18 trillion, well, the federal government will, on healthcare. So we can deduct that from the $52 trillion, so that leaves us with the $34 trillion we need in new taxes / revenue for the government. So let's go ahead and go on. So how do we finance Medicare for All? So it's going to be three things really: redirecting spending, spending cuts, and tax increases. So where can we redirect spending? We can redirect all $6.1 trillion in existing state and local government spending on healthcare to the federal government. That is a lot of money. Instead of $6.1 trillion in state and local spending going to Medicaid, CHIP, and private insurance premiums of government employees, it'll go towards the federal government. So the federal government can use this revenue for Medicare for All, essentially. So we start with $34 trillion. Now we're down by $6.1 trillion. That leaves us with $27.9 trillion in revenue we still need to finance Medicare for All. Now let's go to the next slide. So where can we cut spending? We can cut $1.8 trillion in spending from the Urban Institute summary by mandating 2.3% administrative costs instead of 6% administrative costs. This will leave us with $26.1 trillion still needed in revenue to finance Medicare for All. So next, we can cut $1.7 trillion in spending from prescription drug reform. And we can do that by setting prices at 70% below current Medicare prices for brand name prescription drugs and having a net 30% reduction in Medicare prices for generic drugs. That's a pretty big decrease, but the pharmaceutical industry is just getting away with so much greed right now, so I don't really mind it. But that will leave us with $24.4 trillion when you subtract that 1.7. Let's go to the next page. So we can cut $2.9 trillion in spending by making the following payment reforms. Pay hospitals 110% of current Medicare rates. Pay all hospital-owned physician offices located off campus at the physician office rate. Instituting bundled payments for inpatient care and 90 days of post-acute care. Making post-acute payments budget neutral, risk adjusted, and set prospectively on an annual basis with episode grouping. Now, I honestly don't understand that last bit, but to go back to the payment reforms, so more rural hospitals and your smaller hospitals in the plan that I'm referencing are going to be reimbursed at higher than 110% of Medicare rates. So that's just to alleviate that concern. But the larger hospitals, more medium-sized ones, will be stuck with the 110% current Medicare rates. And I mean, the hospitals already make a ton of money. I know some of their nurses are underpaid, but the hospitals just make a ridiculous amount of money. So we need to control costs there somehow. But that reduces $2.9 trillion and gives us $21.5 trillion left we need. Let's go to the next slide. And the final spending cut. So Medicare for All has the ability to save $1.1 trillion in spending due to single-payer healthcare systems having the ability to reduce medical cost growth rates over time. That just means that as a country, we will spend less on medical supplies, just healthcare in general as time progresses. So that reduces $1.1 trillion from our total. So now we're left with $20.4 trillion still needed to finance Medicare for all. So let's go to the next slide. So where can we raise taxes? So this is a big one. We can raise $8.8 trillion by taxing employers and 98% of what they pay for healthcare right now. Employers pay a hell of a lot per employee. I know it's over $10,000 usually on average per employee. This will save employers at least 2% on that payment. Instead, that payment will be a tax that goes to the federal government, more like a little Medicare tax we have right now for the payroll. But that would reduce $8.8 trillion from our total, leaving us with $11.6 trillion revenue still needed. So we can raise $1.4 trillion in new federal taxes due to millions of Americans having additional take-home pay for Medicare for all. This additional take-home pay would come largely from $3.7 trillion that would no longer be spent on employer-based health insurance, as well as the elimination of health savings accounts. So that's a lot more money in an employer's hand. They'll give it to the employee. It'll be taxed. More people have disposable income. That'll be taxed. I mean, it's going to be great. So that would raise $1.4 trillion over 10 years. Subtracting that from our previous total, now we have $10.2 trillion we need to finance Medicare for all. We can raise $2.3 trillion in new taxes by implementing measures that lower the IRS tax collection gap from 15% to 10%. There are so many measures outlined in the plan that I looked at to enhance the IRS tax collection. So really to sum it up, the main measures are targeted at the very wealthy and international corporations, but you can look more at the study, which will be linked in the description if you are curious for the specific reasons. And with that out of the way, if you can subtract $2.3 trillion, now we have $7.9 trillion left we need for to finance Medicare for all. We can raise $3 trillion in new taxes by implementing a 4% surtax on anyone with a net worth above $1 billion and taxing capital gains as ordinary income. Yes, to the 4% surtax. I mean, we need a wealth tax in this country. I mean, especially for billionaires like Jeff Bezos. And then in terms of taxing capital gains as ordinary income, I know right now capital gains has tax brackets of 0, 10, and 20% depending on filing status, and the highest marginal tax rate for the income tax bracket is 37%. So the people who are investors will be paying the income tax rates instead of the capital gains rates that are currently in place. That'll raise a lot more revenue along with the surtax that I just listed. So that in total that would raise $3 trillion, so we can deduct that from the 7.9, so now we have $4.9 trillion left we need to finance Medicare for all. Let's go to the next slide. So we can raise $2.9 trillion in new taxes by repealing the Tax Cuts and Jobs Act of 2017, better known as the Trump tax cuts. Those tax cuts largely went to the wealthy and the large international corporations, and we can get more revenue by taxing corporations that pay 0 in federal income taxes at 7%. That is, I like that. So we can subtract that $2.9 trillion from the 4.9, and we're left with $2 trillion over 10 years needed to finance Medicare for all. It's getting pretty low. We can raise $900 billion in new taxes by implementing a financial transaction tax of 0.1% on stock trades and bonds. And I know Bernie Sanders has a similar tax. His is a 0.5% on stock trades and a 0.1% on bonds, and it would raise more, but this would still raise $900 billion over 10 years. So that's a lot to deduct. And so if we subtract that, we are left with $1.1 trillion in revenue still needed. We can raise $800 billion in new taxes by eliminating the Overseas Contingency Operations Fund. I mean, that's related to military spending. I definitely would like to see the military budget decreased in some areas, so that's great. So if we subtract that, we're left with $300 billion of revenue still needed to finance Medicare for all. We are in the end game. All right, and finally, we can raise $300 billion in new taxes by making the estate tax more progressive with a top 77% bracket on estates valued over $1 billion. Jeff Bezos, for example, and returning to the state tax exemption rate in 2009. So those reforms would save us a little over $300 billion over 10 years, which would in turn leave us with $0 in revenue needed to finance Medicare for all. So guess what? We have found a way to pay for Medicare for all. Woo! So really the conclusion of all this is we can pay for Medicare for all. The challenge really is getting it through Congress, getting it signed into law, and the organizing effort around it. It's popular with the public. I mean, it ranges usually from the mid-50s to low 70s in approval ratings, but we've got a long way to go and a lot of propaganda to battle for sure. And that concludes the video. Here are these sources right here. All right. Thank you so much for watching.